Okay, let's start these microbiology USMLE hits videos presented by me, Dr. Mohammed Abdel Fattah. I hope that these videos help all the USMLE Step 1 exam takers. And these videos are mainly designed to stress on the high yield facts that you are required to know before entering your USMLE Step 1 exam. Let's start now by the hit number 1, which is the gram-positive lab algorithm. Okay. Before I start talking about the gram-positive lab algorithm, I have to fastly tell you that the bacteria is classified according to their gram stain into gram-positive bacteria and gram-negative bacteria. And the gram-positive bacteria with a P appears blue with a B. And the gram-negative bacteria appears red. Also, the bacteria, according to their shape, are classified into this one, which is the cocci, and this one, which is the rods. So the bacteria are either gram-positive cocci or gram-positive rods, or gram-negative cocci or gram-negative rods. Okay, we will start by talking about the gram-positive bacteria. And the first thing you have to know is the gram-positive lab algorithm. This lab algorithm is used to identify the gram-positive bacteria on any specimen you have. If I have a specimen, a sample, and I want to know which gram-positive bacteria is present in this sample, I have to follow this algorithm. The first thing you do in any sample, you suspect that there is bacteria inside, is that you put the gram stain. Check the color under the microscope and you will find that these are gram-positive. So they will appear, yes, of course, they will appear blue. The first thing to do is you have to look under the microscope and see the shape you have. If the bacteria looks like this, so they are cocci. If the bacteria looks like this, so they are rods, or some call them bacilli. Okay, let's start by talking about the cocci. If I found cocci under the microscope, what's the first step I should do? You check, the first step is to check for catalase enzyme. Check out if the bacteria have a catalase enzyme activity, and these are called catalase positive, or the bacteria does not have a catalase activity and it's called catalase negative. So what is the catalase enzyme? Let me explain this simply. These are the neutrophils. One of the mechanisms by which the neutrophils can kill the bacteria is the production of some toxic molecules. One of these molecules is the H2O2, or the hydrogen peroxide. The hydrogen peroxide is used by the neutrophils as a precursor to produce some toxic molecules by which the neutrophils kill bacteria. Some bacteria defend themselves by production of an enzyme called catalase. This enzyme catalyzes the conversion of the H2O2 into H2O and oxygen. So how to test for catalase enzyme activity in any bacteria? You get the sample, put some H2O2 If you got some gas bubbles, this is an indicator of oxygen release. So the bacteria produced the catalase, which converted the H2O2 into H2O and oxygen. The oxygen was released as gas bubbles that you see. So the bacteria is so-called catalase positive. If no gas bubbles produced, so the bacteria will be catalase negative. So the first step you do, if you saw cocci under the microscope with a C, is to do catalase test with a C and see if the bacteria is catalase positive or the bacteria is catalase negative. If the bacteria is catalase positive, these are staph. If the bacteria is catalase negative, these are strep. And if you notice that streptococci, if these bacteria which are arranged like this, they are arranged in strips. So that's why they are called streptococci. And the staph is the bacteria which is arranged like this. They are arranged in aggregates, so they are called staph. Staph means that they aggregate. If you see the negative sample, for the catalase, if you see the negative sample, it looks like the strip. It looks like the strip. So this reminds you that the streptococci, the strep, are catalase negative, and the staph are catalase positive. Okay. If I put some H2O2 and I had gas bubbles, so I'm catalase positive, I'm in front of staph. Is it Staph aureus or other types of staph? The next step, if you got staph, is to test for coagulase enzyme, and it's another C. So at first I test for catalase with a C. If I got staph, I will test for a coagulase with a C. So what's coagulase enzyme? Coagulase enzyme is the enzyme produced by Staph aureus to coagulate the fibrinogen and form fibrin. The fibrin form a network or a wall around the area infected with the Staph aureus. That's why Staph aureus produced localized inflammation. It produced localized inflammation due to the formation of a wall of fibrin. This wall of fibrin is formed due to the coagulase enzyme produced by the Staph aureus, which convert the fibrinogen into fibrin, which coat or form a wall around the area infected by Staph aureus. That's why Staph aureus causes abscess, and that's why abscess is localized inflammatory area, because it's surrounded by a wall of fibrin made by the coagulase enzyme released by Staph aureus. So which type of staph is coagulase positive? Yes, it's Staph aureus. It's Staph aureus, coagulase positive. And which type of staph is coagulase negative? They are the other types of staph. They are the others. So the Staph aureus is coagulase positive and the others are coagulase negative. How can I test for coagulase in any sample? Get the sample, put some fibrinogen or put some protein. If it coagulated, if the protein became a coagulum, so the bacteria in the sample are coagulase positive. And these are Staph aureus. And the others are coagulase negative. So what are the others? The others are either Staph epidermidis or Staph saprophyticus. Staph epidermidis or Staph saprophyticus. They are coagulase negative. So how can I test for Staph epidermidis or Staph saprophyticus? I put an antibiotic called novobiocin. I will put an antibiotic called novobiosin and see if the bacteria is novobiosin sensitive or novobiosin resistant. So to make you remember, if I have a bacteria which is coagulase negative with an N, I put novobiosin with an N and see if these bacteria are novobiosin sensitive or novobiosin resistant. If it's novobiosin sensitive, remember that this is a bacteria which is normally present on the skin with an S, which is the staph epidermidis, coming from epidermis, because it is normally present in the flora over the skin. If the bacteria is novobiosin resistant, so this is the other type, which is the staph saprophyticus. The staph saprophyticus, by far, it's one of the causes of UTI in sexually active females, and it is treated empirically by vancomycin with or without rifampicin or gentamicin. This is one of the extra facts that you should add from your work. It's treated empirically by vancomycin with or without rifampicin or gentamicin. This is the staph saprophyticus. It's one of the common causes of UTI in sexually active females. So that's it for the staph. So let's review again. I put the gram stain, it's gram positive, it looks blue, and it looks cocci with a C. So I tested for the catalase with a C and found it catalase positive, so it's staph. I tested for the coagulase with a C and found that this is coagulase positive, so it's staph aureus, or coagulase negative. If it's negative with an N, I will put novobiosin with an N. Epidermidis is novobiosin sensitive, and saprophyticus is novobiosin resistant. Okay, so what if the bacteria was catalase negative? If it's catalase negative, so it's streptococci. The next step you should do is to culture on blood agar. Culture on blood agar, and this is a plate of blood. This is a plate of blood. Culture the bacteria on blood agar. The bacteria will grow and make some colonies. Look at the area around each colony and see which type of hemolysis you will get. If the bacteria completely destroyed the RBCs on the blood agar, this is complete hemolysis, and this is beta hemolytic type. This is beta hemolysis. If the bacteria partially destroyed the RBCs on the blood agar, so this is partial hemolysis, and this is called alpha hemolysis. If the bacteria did not destroy any of the RBCs of the blood agar, so this is non-hemolytic or gamma hemolytic bacteria. So on the blood agar, I will either get alpha hemolytic colonies, or beta hemolytic colonies, or gamma hemolytic colonies. The alpha hemolytic colonies means complete RBCs destruction. You will get a clear area around the colony, around each colony. I'm so sorry. The alpha hemolysis means partial hemolysis. So you will get a green area around each colony. The green area means partial destruction of RBCs and formation of biliverdin. The biliverdin looks green, its color is green. And beta means complete hemolysis. So you will get a completely clear area around each colony. And the gamma hemolysis means no hemolysis, non-hemolytic bacteria. So what if I got alpha hemolysis? If you get alpha hemolysis, it's either strep pneumoniae or strep viridans. Strep pneumoniae or strep viridans. And you will put optochin, add the optochin antibiotic, and see if the bacteria is optochin sensitive or optochin resistant. And according to the mnemonic of the RPS, O stands for optochin. V viridans, so the viridans is resistant, and the pneumonia is sensitive. This is the mnemonic of the RPS that you should recall regarding the optochin sensitivity. So who is optochin sensitive? It's the strep pneumoniae. Who is optochin resistant? It's the viridans streptococci. To furtherly differentiate the strep pneumoniae from the viridans, you have to know that the strep pneumoniae is capsulated. It's one of the capsulated organisms. It has a capsule. So as long as it has a capsule, it can be detected by a test which is called Kellang test. The Kellang test is performed by adding some antibodies against the capsule of the strep pneumoniae. These antibodies will react against the capsule of strep pneumoniae, and you will see the capsule looks swollen under the microscope. You see swollen capsule under the microscope. This is the strep pneumoniae Kellang test. Kellang, it's called Kellang. Kellang means adding some antibodies to the strep pneumoniae. These antibodies will react against the capsule, leading to capsular swelling under the microscope. While the viridans is non-capsulated, it has no capsule. No capsule, the viridans. Okay. So that's it for the alpha hemolysis. So what if I got beta hemolysis? Means I got complete hemolysis, clear area around the RBCs, clear area around the colonies. The beta hemolytic bacteria with a B are either group A, beta hemolytic streptococci, or group B, beta hemolytic streptococci. So I have group A, group B. Group A streptococci, group B streptococci. Both of them are beta hemolytic. If I got beta hemolysis with a B, add bacitracin with a B. I'll add a bacitracin with a B. And see, this is also an antibiotic, and see if it's bacitracin sensitive or the bacteria is bacitracin resistant. The group B streptococci are bacitracin resistant, and the group A streptococci are bacitracin sensitive. And to remember this, please recall this mnemonic. The group B is not affected by the bacitracin with a B. The group B is not affected by the B. The group B is not affected by the B. So the group B streptococci are resistant to bacitracin with a B. The group B streptococci are called strep agalactic. And the group A streptococci are called the strep pyogens, which lead to rheumatic fever and post-streptococcal glomerulonephritis after sore throat or skin infection. Okay, that's it for the beta hemolysis. Let's see if I got gamma hemolysis. If you got gamma hemolysis, so these are the group D streptococci. The group D streptococci, which are either enterococci or non-enterococcus bacteria. How to differentiate between them? How to differentiate between them? Actually, you should not. They are not so important, not so high yield for the USMLE Step 1 exam. They are not so high yield for the microbiology. However, they include Enterococcus faecalis and the strep bovis. The only thing that you should know is that strep bovis are one of the common causes of of infective endocarditis in the colorectal cancer patient, as I will talk later on. Okay, that's it for the cocci. So I finished the gram-positive cocci lab algorithm. If you saw bacilli, if you saw roads, actually thanks God, because no lab algorithm for the roads, because each of them has a characteristic appearance under the microscope. They don't need any test to differentiate between them. I don't need any test. These include the Clostridium, Corynebacterium, Listeria, Bacillus, and we will talk about them later on. Sometimes you get branching filaments. Sometimes you get branching filaments. And to send you straight, the branching filaments looks like this. I will let you see an image. Just 1 minute, please. That's it. Okay, let's see. These are the branching filament bacteria. See it. Have a look. These are the branching filament bacteria. You get something like this. It looks like the spaghetti, you know. It's look branching. These are branching filaments. The branching filaments include the actinomycetes and nocardia. You can differentiate them easily by putting an acid-fast stain, the Ziehl-Neelsen stain. Actinomycetes are not stained by the Ziehl-Neelsen, they are not acid-fast, but the nocardia are acid-fast and they are stained by Ziehl-Neelsen stain. And we will talk about the actinomycetes and nocardia later on. So that's the first HIT video in the microbiology USMLE HIT videos. I hope that you gained the benefit from this video, and now you can recall every single fact and information in the gram-positive lab algorithm block in your first aid. Thank you. See you later.